Hello viewers, welcome to today's COVID-19 update for the 16th of September 2020. Today we are here with the Honorable Minister of Health, Dr. Frank Anthony. Good day, Dr. Anthony.
Good day, and thank you for having me on the program.
You're welcome, sir. Let us talk about the parliamentary staff. It was announced that 14 of them have tested positive for COVID-19. Could you give us an update on that? How will it affect the parliamentary proceedings and so on?
Well, after the speaker tested positive some time ago, it was decided that we'll test the entire parliamentary staff. So we did 126 tests on various members of the parliamentary staff, and of those 126, 14 came back positive. So the technical people from the Ministry of Health would have had some discussions with the clerk of the National Assembly, and the staff was advised, once tested positive, that they have to go into isolation. So they have been sent on home isolation, so they'll remain at home for the next 10 days or so, and after which we'll observe them for another 3 days, and once they're symptom-free, they will be allowed to return to work. So that's our process. Each one of them would have been spoken to. We would have explained to them the signs and symptoms of COVID, because most of the persons are asymptomatic. So they have no signs or symptoms, but they're infectious, meaning that they can transmit the disease to somebody else. So we've explained to them the precautions that they need to take at home, and if they develop any signs or symptoms, such as having coughing or they have difficulty breathing, then they have a hotline that they can call within the ministry, and once they call that hotline, a medical person would take them through a number of PACE. And if they need, or if that person determines that they would need for the investigation, then we have a mobile team that can respond to them and to move them, if they deteriorate further, to the hospital. Because persons who have breathing difficulty, they're better managed in an institution such as a hospital. And we, while at this moment, the 14 people who have tested positive do not require any hospitalization, but we want the general public to know that if they are on home isolation and they develop any breathing difficulty, then they need to contact our hotline numbers so that we can make arrangements to bring them into one of our hospitals. So I just want people to understand the process. But as with the 14 persons from the parliamentary staff, we have taken those precautions. They are at home. The ministry would be doing contact tracing with the persons who they have been in contact with, and we hope that we would also be able to quarantine those persons, and if they display any signs or symptoms, to also maybe do the PCR test on them. So we are taking some proactive measures here to ensure that everyone is safe.
Okay, do you mind telling us about which departments these people were from, and will their absence affect anything?
I am not sure, but that would be for the clerk of the National Assembly to say which departments and how that might affect their work. But certainly if the Parliament would have 14 persons who are now at home, I think that might affect some of their work. But nevertheless, I think the clerk, as I spoke with him this morning, he said that he has put other systems in place to ensure that whatever we're doing here would not be affected.
Okay, I know we have a strict protocol here with screening and so on when you enter, but any plans to probably up it a bit, like step it up a notch?
Well, I mean, in all public institutions, we should put the relevant measures in place. Those include somebody entering a public building should have a place where they can sanitize their hands because we want to ensure that if they're droplets or people would have touched surfaces that are infected, that by sanitizing their hands, they're reducing the spread of infection to, themselves and maybe to other surfaces that they would touch. So that's the first thing. So a simple thing like having a place where somebody can wash their hands with soap would go a long way in reducing spread. Then, of course, as per the order that we have issued, that you must wear a mask in a public space. So whether you're outdoor or indoors, you're required to wear a mask. Now, mask wearing would reduce the spread of infection tremendously. And depending on the type of mask that you wear, the percentage of that reduction increases, right? So, for example, if you wear an N95 mask, these would give you the highest protection. So the reason why they're called N95, it's because they prevent 95% of the viral particles that would come to you. And while, most people have been saying that it, or most manufacturers would say it prevents 95%, in actuality, they do even more. They would prevent viral particles from passing through the mask by as much as 99% in some instances. So the N95s are really protective, and if you wear them, they would protect you against droplets. They would also protect you against aerosols, which would be smaller particles, and therefore these are what is highly recommended. Surgical or procedural masks also have similar properties, and cloth masks have a certain amount of efficacy, but they're not as effective as surgical mask or N95 mask. Nevertheless, if you wear a cloth mask, it would give you protection as well, especially from droplets. So that is why it's important that we encourage people to wear masks. And then the third thing that we want to emphasize is that when you're in public space, that you keep your distance. And that social distance that we are recommending, it's about 6 feet apart. And the reason being is that if somebody sneezes or cough and there are droplets, that those droplets tend to go less than 6 feet. So if you're standing in a room and there's somebody coughing or there's droplets, then theoretically it would be more difficult if you're standing 6 feet away for you to be infected. So when you combine these three measures, they can enhance your safety and protection, and that's what we want to emphasize. So if everybody take these precautions, then everybody will remain safe and protected. It is better that we take these preventative measures and stay away from the infection or remain infection-free, rather than we become infected and then, we can even end up in the hospital. And in some instances, those persons who are hospitalized, a percentage of them would end up in the ICU. It's much harder to care for someone in an ICU than it is to take these simple measures to prevent infection. And it's more costly. We are not even looking at the money now, but we want people really to prevent rather than us having to try to administer treatment. So, if everybody take these precautions, I think we'll have a safer country.
Thank you, Dr. Anthony. And thank you, viewers, for watching. Today, our COVID-19 update was focused on the 14 staff members of Parliament who were tested positive for COVID-19. We spoke with the Honorable Minister of Health, Dr. Frank Anthony.